Welcome back to another episode of Benny Boyz with a Z. I'm Nick.
Welcome back to the Benny Boyz. It's your boy Josh, and today we'll be going over the 5 most important terms to know in your insurance plan.
Let's start things off by breaking down the most important and probably most misunderstood term in your insurance plan, the deductible. As one of the most significant aspects of any insurance plan, the deductible is the amount of money that must be satisfied by a member before the insurance company will begin to share the cost of services with that member. Prescriptions and copays do not count towards your deductible, but they do contribute towards your out-of-pocket maximum. The lower your deductible, the sooner the insurance company will begin to share the cost of covered services with that member.
After reaching your deductible, your coinsurance begins, which means you and your healthcare provider will begin splitting the cost of a covered healthcare service based on your plan's coinsurance percentage. You share the cost of services with your insurance company until you reach your maximum out-of-pocket. For example, if your deductible was $2,000 and your coinsurance was 70%, you would need to satisfy your $2,000 deductible, after which your coinsurance would begin paying 70% of services, with you paying the other 30% until you reach your maximum out-of-pocket.
Now that we covered coinsurance, let's talk about a term that it often gets confused with, your copay. A copay is a fixed amount that you pay for a covered healthcare service. Copays can vary for different services within the same plan, such as lab tests, office visits, and prescriptions. Be sure to check your plan's exact summary of benefits to see what your copays are for things like prescription tiers and visits to your doctor.
Your maximum out-of-pocket represents the total amount of money that you will have to pay for covered services during the calendar year your plan is active. After reaching your max out-of-pocket through deductibles, co-payments, coinsurance, your healthcare provider will begin to pay 100% of covered benefits for the remainder of the calendar year your plan is active. Remember that you first need to satisfy your deductible and then use your coinsurance to reach your max out-of-pocket.
Insurance premiums are the amount of money that you or your employer pay each month in order to keep your insurance policy active. Your insurance premiums do not contribute towards your deductible or your out-of-pocket maximum. If you're on a group medical policy, your premium will typically be taken out as a portion of your monthly paycheck. Thanks for joining us on another episode of Benny Boyz, where we covered 5 of the most commonly misunderstood and important terms in your medical insurance plan.
Join us next time, where we will be covering HSA plans and the benefits of being enrolled in one. And until then,
We'll see you next time.